Hi, this is Leonard Kish with Health IT TV. I'm here with Dr. Blake McKinney, an ER physician with CirrusMD, the CMO and co-founder of a Colorado company that won the Venture Plus mHealth Challenge back in November, which is why you're here now. You kind of won this presence at the HX360 Pavilion at HIMSS 16. So Blake, tell me a little bit about CirrusMD, why you co-founded this company as an ER physician, what problem you're trying to solve.
Great, thanks, Leonard, and it's great to be at HIMSS. CirrusMD is a software solution that helps doctors and patients communicate better. I started it out of a frustrating point in where I sit in the healthcare system. I'm an ER doctor. And when I look at my lobby, packed full of patients, all waiting, all having difficulty with accessing a doctor, and when I wipe the tables clean and I think about society and who in society has the best access to doctors,
right?
It's the doctor's own friends and family, right? And so if I think about what's occurring in nature, so to speak, how do my friends and family access me when something's bothering them?
Right.
And they could call me on the phone, they could come over to my house, they could email me.
Right.
But they don't. They text me.
Right. It's just efficient. It's what we're used to.
It's what we're used to in our civilian lives,
right,
so to speak. So I look at the lobby of my emergency room and I ask myself, why can't all of these people just have a doctor who they can text?
Right.
So one night, I'm texting back and forth with my sister-in-law. And she's in Denver, and she's worried about the baby's breathing. And I very quickly get her on the telephone, and I hear panic in her voice. And I tell her, you're going to have to take that baby into the ER and let the doctor lay eyes on it tonight. She doesn't really want to do that. Yeah. She says, it's snowy and icy. I just had a baby. Can we FaceTime? So I agree. And then iPhone to iPhone, my living room to hers, I've got a crystal clear picture of what I can tell is a warm pink dry baby, bright-eyed looking around with a little bit of a stuffy nose.
Right.
We lift up her shirt, I watch her breathe, there are no chest retractions, no nasal flaring, no obvious sign of labored breathing.
Right.
She's feeding well, she looks good to me, and I'm the doctor who you'd see in the emergency room. So in that moment, I changed my story from go into the ER to you're cool. We can we can wait, but and this is where CirrusMD is different from any other telemedicine company. The encounter always ends with, let's stay in touch.
Right.
Here's when I'd want you to reach back out.
Right.
As opposed to any of the other one-time only offerings out there, which a lot of insurers, a lot of employers are picking up right now. Set up a limited encounter with a one-time only phone or video chat with a doctor you'll never see again.
So your patients can always come back and re-engage with the same group of physicians. In some use cases, you even flow back into the HIEs so that when the encounter populates the EHR, so it's really a closed loop kind of a system as opposed to these one-off kinds of encounters.
That's how we've designed it. And if you believe, as I believe, that all healthcare is local, as an extension of that, I believe all telemedicine is local.
Right.
And that the best telemedicine occurs with the system that you get your in-person medicine from.
Right.
So our doctors are always local or regional to the covered member population in partnership with a health system with integrations into the local health information exchange, the ability to order tests, make smart referrals, prescribe off formulary, to practice according to protocols for complex disease management, mental health, and acute care.
Right. So, of course, the reason that these kinds of solutions haven't existed before is because, why would a doctor want patients calling, FaceTiming, texting all the time? So how does that work with Cirrus?
So the entire health economy is transitioning from volume-based care to value-based care.
Right.
Physicians for the last 60 plus years have been making their money one at a time.
Right.
Next patient, one after another, line them up and see them, and that's the way we keep the lights on in the building.
Like an assembly line.
The health economic model of the near future means that the office visit that doesn't happen now becomes profitable for the doctor. Right. Doctors are being told for this segment of your population, or in certain health systems that are more integrated, for everybody,
Right.
If you can get the patient what they need without requiring them to come in, that's a benefit to everybody.
The anti-claim, I think it's been called.
The
before.
anti-claim. That's
right.
a wonderful term. So CirrusMD exists as a relational tool
Right.
to allow doctors in a value-based care setting to treat their patients remotely and to keep in touch.
Right.
Doctors on CirrusMD right now are managing complex patients over days and weeks as their illness either progresses or improves.
Right.
They're making sure they get to the right point in the system where they need to be, and doctors are acting as kind of the best navigator that you could ever have in healthcare.
And I've talked about how the core value proposition or the core item of value in healthcare is a decision.
Yes.
And I think what you guys are doing was pretty interesting in that it's largely text first. I think you've said 90% text first.
Yes.
But it's immediate physician access. So you get the right person to make the right kind of decision at relatively low cost really, really quickly.
Exactly. And a doctor doesn't always have to make a diagnosis.
Right.
What he does have to make is a plan.
Right.
So that's the real world of medicine, but
that's hard to do sometimes in the clinic because the person is there right now, and you might not have time to let things play out.
Exactly.
Particularly if it's nothing serious.
Exactly. I like the example you've always brought up about doctors in a billable event scenario where each patient encounter has to be encapsulated into a billable event. That doctor has to make a call right then as to what it is.
Right.
On our system, in a relational basis, the same as with a doctor's friends and family, it's okay sometimes to do nothing.
Right.
And say, we're going to keep an eye on this. As long as I can feel reassured as the doctor that you can reach me again. Or if not me, my partner, who's a similar specialty, who practices in the same environment, who I share a reciprocity with. And what I mean by that is that doctors who are unaffiliated with one another on a telemedicine service don't share an accountability or a reciprocity with one another.
Right.
If a patient follows back up on a disintegrated service, and I'm the doctor today, and you spoke with a different doctor yesterday, I say, I don't know what that doctor told you.
Right.
But if we're in the same system practicing together, we share that relationship and we own the life together.
Right. And so this is obviously largely for risk-bearing entities.
That's where it makes the most sense, I think.
Okay.
And
how many patients have access to the CirrusMD right now?
Currently, across all the patients we provide access to, about 250,000.
Wow.
So
great.
We're the largest company in terms of lives represented in the Medicaid space right now. Wow. Currently in Colorado, there are 140,000 Medicaid beneficiaries who have better direct access to a physician than many people with commercial insurance.
Great. Well, congratulations on all your success, and
thank you very much.
There's a lot more coming.
I'll be glad to chat again.
Thanks a lot, Blake.
All right, Leonard.
Thanks. This is Leonard Kish with Health TV with Dr. Blake McKinney, CirrusMD.